Hello, my name's Nina Hohlbein, and I'll be covering the topic of medication dispensing machines, in particular InstyMeds. I had trouble finding information about medication dispensing machines as a general topic, so I just decided to do a rundown on a specific company, in particular InstyMeds. InstyMeds make patients better, quicker, by providing immediate access to acute medications. The idea for InstyMeds came from Dr. Rosenblum in 1999. He was sent out late one night to fill a prescription for his son's ear infection, but due to the late hour, no pharmacy was open. That gave him the idea for a medication dispensing machine at the point of care, and he spent the next 5 years working with other doctors and engineers to develop the idea for a medication dispensing machine to eliminate that problem. According to the InstyMeds website, InstyMeds provides an automated system, much like a bank ATM, which dispenses the prescription medications directly to patients at the point of care. InstyMed machines are usually in outpatient or urgent care facilities where you'd most likely need a prescription urgently. These machines help to increase prescription fill rates and reduce further costs when patients are non-compliant, not to mention their convenience. You can pick up the prescription without ever leaving the hospital, and you don't have to waste time and effort and energy and money trying to find an open pharmacy. InstyMeds' mission. InstyMeds is in business to implement methods allowing for rapid and convenient delivery of acute medications to make patients better, quicker. We will tirelessly endeavor to make antibiotic and pain relief medications available to all people at all times. InstyMed machines allow for prescription fill rates of almost 100%, ease of use for the clinic and the patient. The machines seem to take care of everything, including insurance, inventory, and accuracy in dispensing. They also help to attract and retain patients. They get the patient better quicker by getting them their medications quicker, and they eliminate physician handwriting errors. InstyMed machines can hold up to 1,000 medications. It's essentially a one-stop shop. These machines function with essentially no downtime. According to their website, it's 0.14%. They give out the correct prescription 100% of the time due to their barcode triple check. And because these machines are online 24/7, 365 days a year, these barcodes also help to keep the machine stocked with the correct medications. When stocks are getting low or when expiration dates are nearing, replenishments are shipped to the hospital automatically. And prescriptions, additionally, can be sent by the physician directly to the machine via the hospital's EMR. These machines are not made to dispense refills, so you would still visit your regular pharmacist for your refills. They're just made for first fill prescriptions. Now I'm going to show a short video of an InstyMed machine in use.
This is the InstyMeds dispenser. It is very convenient for the patient to use. The patient's going to take this prescription. It's going to be a code on here. They're going to come up to the dispenser, very easily punch in their code. The next thing it's going to ask them is their date of birth. From there, it's going to total up their copay. Patients have the option to pay by credit card, debit card, or cash. Their change is dispensed down here. Patient can choose to take a receipt if they wish. All their prescriptions are dispensed down here. The neat thing about the InstyMeds dispenser is all of the prescriptions are labeled inside before it drops out for the patient. The telephone here is available to the patient should the patient have any questions about their insurance, about their copay, or any questions in regards to their medication. It is a direct dial phone. The patient just picks it up, and somebody is available 24 hours a day, 7 days a week. All right, now let's take a look at the inside of the dispenser. You can see right here, this is where all the product that is going to be used is going to be placed. Each magazine holds anywhere up to 11 bottles, so every one of these magazines will hold the same drug, same quantity, and same strength. There is a webcam inside. We're able to take a look at the label stock as well as the receipt paper, if it needs to be changed out, as well as do any type of maintenance remotely. After the patient enters their code, this is what takes place on the inside. There's going to be 3 verification checkpoints that are done. The first one's going to be on the magazine to make sure that it did dispense the correct medication. From there, it's going to take it over to a second area where it's going to actually scan the bottle to make sure that that bottle did come from the correct location. If it was incorrect at this point, it would actually drop it into the reject bin below and go try again. The second scan has been done, and now it's going to label the product. Now that the product has been labeled, it's going to verify that information. And it's going to drop it into the holding bin. If there had been more than one bottle, it will hold it in the holding bin and go try again for the second or third bottle. And from here, it's going to dispense it for the patient. The medication is dispensed. The patient is now on their way, feeling better, quicker.
In the future, I can definitely see a future for medication dispensing machines. I think they can be very successful. I think there's definitely a market and a need for these, especially since waiting for a prescription, in urgent cases, waiting even a few short hours to fill a prescription can be agonizing, not to mention harmful to the patient. I certainly hope to see these machines at facilities near us soon. And these are my sources. Thanks for watching.